Calls for addressing Mississippi's health care coverage gap filled the Capitol this afternoon. Care for Mississippi urged lawmakers to pass legislation that would close the gap and offer health care for over 200,000 Mississippians. 12 News senior political correspondent Richard Lake joins us now live from the state capitol. Richard, what more can you tell us about what they had to share?
Yeah, Melanie, so Mississippians who fall within this coverage gap are individuals who make too much money to qualify for Medicaid, but not enough money to pay for private health insurance. I spoke to one woman who is a part of this coverage gap about her experience and what she's hoping to see from lawmakers. Lisha Preston has a full-time job, an associate degree, and is currently working on her bachelor's degree. In 2019, Preston was hospitalized for 2 weeks with a case of pneumonia. She had to pay out of pocket for her treatments because she could not afford the premiums offered through her employer's health insurance.
4 years later, I'm still paying those medical debts.
Her 7-year-old son, who suffers with ADHD, is covered through Medicaid. But Preston makes too much money herself to qualify for any government assistance.
While I was pregnant, it was hard. It was hard then and it's hard now. The high deductibles, medication, I'm still doing the most now.
When it comes to the health of Preston and her son, there's oftentimes more questions than answers.
You're looking at doctor visits, you're looking at trying to make sure everything will be covered or at least able to make it there. So you're thinking about gas money, you're thinking about lunch, you're thinking about the medicine.
A total of 8 bills have been filed this legislative session that would expand or modify Medicaid and shorten the coverage gap. One plan in the House, authored by House Minority Leader Representative Robert Johnson, and one worked on by Lieutenant Governor Delbert Hosemann in the Senate, are being considered in both chambers. There are differences in both plans, but both would allow for higher salaries to receive coverage.
I'm hoping it will pass as soon as possible. There are so many consumers that are not within or able to get that assistance.
If one of those bills passed both chambers and ended up on the governor's desk, chances are slim Governor Reeves would sign it into law. In a post published on X on Tuesday, Governor Reeves echoed former President Donald Trump's sentiments, saying in part, quote, "Obamacare sucks." Now, if Governor Reeves did veto a bill that was passed by the legislature could override his veto through a 2/3 vote in both chambers. Reporting live from the state capitol, Richard Lake, 12 News.